I didn't believe these legs were not going to be cut. You know, I know about diabetic wounds.
At the Human Garage, many of the people who walk through our doors come to us after long, exhausting medical journeys. Lilian Mutahi has been one of them.
I got sick in 2008. I was diagnosed with diabetes, high blood pressure, and arthritis.
She has been living with diabetes and hypertension, and at one point, the complications from non-healing diabetic wounds placed her at a real risk of losing her legs.
And I had gone to one hospital in Nakuru, and then the surgeon came and told me, we have to remove those legs because those nerves cannot get healed.
She sought help across multiple healthcare systems, from local hospitals to facilities at the United States, but her wounds continued to deteriorate.
These wounds are burning. They are burning like hell, which is true. I could feel like it is hot water that has been poured on my leg. And when this one starts working, the other one starts. Both of them. Can you now see?
Today, Lilian is in her 9th session with us. The wounds that once refused to heal have closed completely, and her focus has shifted from survival to regaining independence.
I've been treated for those 6 sessions. These wounds got healed.
This is Lilian's story, shared in her own words.
Hello, how are you?
I'm good.
Please introduce yourself.
Thank you. My name is Lilian Mutahi. I am 67 years old, and I started coming to the Human Garage last year, and I did 6 sessions. I got sick in 2008, and I was feeling very, very tired. I'm a teacher by profession, and when I started getting sick, I'm a head teacher. On the wall, there are things we put on the wall, just near you, like how much money have you received? What is your project or your priorities? Then I could see that I was not able to read. You put them there purposely when the boss comes in, like Matiang can just come in and ask you a question about the money. You cannot remember. So you just make like that, and now I remember I was given 500,000, and my intention is to do 1, 2, 3, 4. And then I could say, oh my, even if they come, I cannot read. What is wrong with my eyes? And then I decided to do computer. And I got a computer. After some few lessons, my back got very, very tired. So I could find myself always, sometimes I got out to the door and lean on the door and try to, so like now a massage with the door.
With the door now.
And then I said, no, I cannot continue with the computer. I went to St. Mary's Hospital. They started being treated. The first day, I was diagnosed with diabetes. I didn't know what was diabetes by then. And I was diagnosed with high blood pressure, and arthritis. And I started the treatment that day. I was given insulin in my body. I was admitted from morning up to 5 so that I could get the insulin. And when I was going back home, when I reached Nakuru town, I felt like my eyes have opened. I said, oh, sure, now I agree with those people. I have sugars because my eyes are opening, and I used to just see just there. And now I could see properly. And then when I was attending St. Mary's, I was given the glasses. I wore the glasses for some days because I could stand in front of the parade, and then I could see two children, you with two heads. And I said, oh my God, these kids are having so many heads. What is it all about? That is when I was given the glasses. And I continued. I went to St. Mary for a bigger time. And I was also treated with I started feeling like there are needles in my body. Needles all over. And especially this part, the shoulder joint here, down here.
Yes.
It was hurting, so tired. So always I was trying to do like this. And now I was diagnosed. I was given tablets for high blood pressure. I was given the gabapentin for the nerves, and the diabetes treatment. And I continued. Instead of getting well, I was getting worse. So I was given very high doses. Every time I go, the dose was made higher. And then the knees, because now of the arthritis, they became worse. And in 2022, I went to America because of the knees. And I stayed there. They were trying to stabilize my pressure so that I could get a surgery on my right leg because it was running away from me. I started going this way.
Okay.
And in 2023, I got the surgery. So I have a knee replacement on one knee. After the replacement, the doctor told me it takes 2 years to get healed. Not as quick as people may probably think, or one want you to get healed. And in those 2 years, in 2024, I came here in December, and when I was going back, it was very cold on the other side. So I stayed in the airport waiting to be collected for some, and it was very cold. But I had worn properly because I knew it was cold. But by the time I was reaching the house, I started, I don't know what to call it, on this joint. And it has been like that until I was got a massager, like the mats I'm sleeping on there.
Yes.
But they have got something inside
Yes.
that can massage
That
you
can massage your back.
when you put them on.
Yes.
With electricity.
Yes.
And after massaging myself for 1 month, I started feeling like it is getting off.
Okay.
Okay. But after 2-3 days, it comes back. And then I have my sister. my sister had a problem with her legs, but she doesn't want to tell anybody because she thinks that mommy is going to get worried. But she came here and she was treated. And then she told me, you know, I don't know, not I'm going to tell you. When I told her I was going for surgery, I wish you don't go for surgery. Come back to Kenya. I take you to Dr. Hamisi or the foot doctor, their foot doctor. He has treated my legs and now I'm okay. Then mommy, I'm taking her there. By the time my mother was being brought here, she had a swollen hand. Yeah. And she was not able to feed herself. And now mommy is feeding herself. That was good news for us. We were so happy. But by that time, now I had started the process of the surgery. I was supposed to be operated on both legs, but I refused. I did one, the one that was getting lost. And when I came on this side and found mommy, hey, mommy has improved greatly. Hey, I told my sister, no, I am coming there now. What I have seen from my mama, if she can improve that big, I'm also coming for that improvement. Because me, I'm half dead. Oh, my nerves. I have taken gabapentin. I started with the one, it's called, I don't know what, or 40. Now I'm taking 75. I think it is the highest.
Yes.
Yeah. And when I went there, I continued with it. But at night, I want to sleep on my this hand. This inaiangusha hivi. I'm running away from the bed, so that I can make my hand fall. So she brought me here, and then I started the treatment in 2024. Was it 24? No, I came in January 2025. And I was to go back in April 2nd. Because you cannot come with a one-way ticket.
Yes.
You must get, when are you coming back? You have to write when you're coming back and you have to pay. So I already managed to do 6 sessions. But I'm telling you, by the time I was coming here, my nerves, because don't you say these are the nerve endings?
Yes.
Can you see a big scar?
True. You can say it.
These are the nerve endings of my leg. From there,
Yes.
all the way, and it has come even up to here. And on this side, I think the nerves goes simultaneously.
Yeah.
Can you see? The brown ones like this were very deep. These ones were wounds, the black parts,
yes.
but it was not as deep as this ones.
Okay.
This time I was burning like hell.
So your leg was all wounds.
Yeah. And they had come from there all the way up to here. Can you see?
Yes.
Can you see the scars?
Yes.
Up to here. And on the other side, can you see? Yeah. This one was very deep. So, you can see the scars. So I started the treatment now.
Yes.
I've been treated for those 6 sessions. These wounds got healed. And before I came here, I was being treated by the Wazungus. Yeah, and there, when you go to the hospital for treatment, you are really treated because it is the insurance that is going to pay for you. If they don't treat you well, insurance refuses
Pray.
to pay. So they must. And you know, we have different sessions. There's a special hospital for Woods only.
Yes.
I was treated. Every time I go there, I tell the doctor, oh my doctor, these woods are burning. They are burning like hell, which is true. I could feel like it is hot water that has been poured on my legs. And when this one starts working, the other one starts. Both of them. Can you now see? Two legs were trying to get the cold weed.
Yes.
And it is night. At night, you are sleeping, but they are burning too
They're
much.
burning.
They stop burning and then they start pinching you with the needles.
Yes.
Needles. So I had it very rough. And on this side, the back side, I got very, very tired. So I decided, now, let me try. Because of the stories I'm getting from my sisters, and I have seen mommy, and she has improved greatly. That's when I came and I started that treatment. Sorry, to me, it is not a treatment, it is a miracle. I didn't believe these legs were not going to be cut. You know, I know about diabetic wounds.
Wounds, yeah.
I mean, they can lead to have, you can ampute up to there next time.
Yes.
From there, and you will remain without legs. So, because they were very painful, I could see it coming. And I was always telling my God, oh my God, please don't allow my legs to be cut. I need them. Yeah, I need them. And I had gone to one hospital in Nakuru. And then the surgeon came and told me, we have to remove those legs because those nerves cannot get healed. That's too much. I told him, come again. And do you know, at night I was crying at night like a baby. And then I told him, no, I want another option. Actually, if I'm going to be operated, it's not in your hospital. You are too fast. How can you just come? You have not even done counseling. You have not told me what is wrong with my legs. And now you are telling me that you are taking me to the theater. I'm not going. Me, I'm not a hen. That's what I told him.
Mm-hmm.
It is only a hen you can go to the house, pick one, come and cut and cook it. And it will not ask you questions. I want to run more. And then he said, okay, you can digest that one. And then he left. And then in the midnight, some young man like you came and told me, I have come to prepare you for theater. You are supposed to be in the theater at 5 o'clock in the morning.
Mm-hmm.
And I asked him, doing what in the theater? Did I say I want to go to the theater? I said, no, the doctor said that you shall be taken to the theater. Munipeleke theater mkanikate miguu. It's not like that. It doesn't work like that. I need more. I'll cut my leg after 6 consecutive visits to big hospitals, including Kenyatta National Hospital, and Tenwek, and Kejabi, and I'll find another 2. I said, you have refused? Yes. I go and tell him you have refused. I said, yes. And then he went. And I called my brother. He's a clinical officer. And I told him, come to the hospital tomorrow. I'm supposed to be in the theater by 5, and I have refused. I want you to come and talk to this surgeon.
Yes.
So that he can explain to you what, because I don't understand.
Yes.
Why he want to ampute my legs.
Yes.
I don't know, and I don't want. So he came, and at 6 o'clock he was there. And he came and told me, I have come to see that doctor. Yeah, okay. Go to the reception there. Tell them about my case. They'll show you where he is. I don't know.
Yes.
And then they called him, and he came and he told him, "No, this lady is suffering from. She has a nerve problem,
Yes.
and the nerves are not treatable. So the only thing we can do, is to cut her legs before it grows and grows up to the knee." And my brother told him, "Is that how you do it?" He has not come here for another time. He has just come. So those nerves are not. They have not been aching for a long time. That's what I think. And then it's like he was challenging the doctor. And then the doctor said, "If you don't want her to be treated here, then go with her." And he called me when he was outside and told me, "Start packing. Go and clear the bill."
What?
Yes. And I left the hospital that day. When I went home, now my sister, Mama Poko, called. "How are you doing?" Um, I have left the hospital because they want to cut my legs and I'm not ready for that. Just to come and get some psychological comfort and understanding. And then she came, and my legs were swollen like this. I said, "These ones are going to burst. Hey, I'm not leaving you here. I'll take you to the doctor." So she took me to another doctor. Was a very good doctor. He checked on my legs and he told me, "This wood, I had a first wood. This I'm going to treat you, but with a lot of discipline and obedience. If you cannot do that, I won't." It was 2014.
Yes.
Now she prescribed for me and told me, "Can you deploy a nurse to come to your house to clean that wood? Because you cannot be able to do it yourself. This is not a normal wood. It is not called a wood. It is called a diabetic wood. It's a special wood." Okay, I said yes. And I went to medical in Nakuru and got a nurse there who was dressing woods. Who had gone to South Africa to do the wood.
Yeah. Yes.
So she was the one who was walking around with the big doctor to explain. And then I went to her for 4 years. That would took 4 good years to get healed. And then now, 2023, 24, I got these ones I have brought here. So when I compared that duration of time that the first wood took for 4 years, and this one I came in January for 3 months, and the woods were they got healed. I couldn't imagine and compare. One, before I had come when I came from US.
Yes.
It is like I was getting fear. So I went to the hospital in Nakuru and I was admitted. When I was admitted there was a nurse who was cleaning me every day. Then I asked her, "Can I give you some little job? What do you want?" "I want you to come to my house and clean my legs." Because from the previous one, I knew they want to be washed, and she said, "Yes, if you are going to pay me 3,000. And I'll be doing it for two days in a week." It's okay. So when I was coming here, and she was coming in my house for cleaning, because she told me these woods need to be washed with saline water. And they are going to be dressed. Namwambia, me, I don't want to know what you are going to do. I want to get healed. Okay? So, I decided to combine this one because of the washing of the wood, because it is important. That one I knew. And I'm telling you, within those 3 months, those woods went away. Oh my God. I'm telling the story to everybody. If you want, if you know you have problems with your nerves, go to the human garage. It is in the garden estate. If you put in your phone to use the GPS will take you up to the human garage. This one I have brought here is my best friend, so she has witnessed that safari. And then she said, hey, seriously? Are the woods healed now? And the other one took 4 years. I'm coming with you. Yeah, let's go. So I came with her, and she has told me, imagine I can do like this. I couldn't move my head like that. Yeah. Now what you need to do is just to become an ambassador.
Yes.
And give your testimony to everybody.
Yes.
And show them where the human garage is. It's not difficult. Just give them human garage, garden estate. Now go to the Google that one, get the location. You'll be there. So we are with her and she's happy. But I told her, be ready to open your porch because money cannot buy life. But healing can save your life. So to me, the human garage is doing a good work. I was asking, why don't you open a center in Nakuru? So that we can reduce this guy waking up so early.
To come here.
Me, I cannot come around. This is my last born. He's like your age. You may look at him like this, I do like this. Or probably he's older than you. He has to come with me because if I get a big stair like that one, I'm not able to climb. And I'm hoping sooner or later I'll be walking without a stick and I'll be able to climb the stairs. I'm impressed.
Definitely getting there.
Yes.
So how are the treatments here at the human garage?
Yes, now about the treatment, you might maybe underrate the treatment because no medicine. It is by massage method, but very unique, and by acupuncture. So you can ask yourself, what is it all about? But before you start the treatment, you are taken to that room there for the scan. So even when you are giving your stories, they have already detected where your problem is coming from. So the massage is treating at the point where the problem is originating from. Today, I told the doctor, do you know that this, or what do we call it, allergy? This allergy is becoming a block to my neck. And then I was given needles here. And they asked me, how is your allergy now? I was like, you are treating my hand, you are asking about my neck. I'm waiting for you to come and take me from here. But I'm wondering how you are going to do me like this, because I can die if you block me from breathing. I said, no, the problem is here, not there. And I was impressed. I keep coughing in the morning, but now it has gone down. So it is not necessary to be very instant. But within the 12 sessions that we are supposed to do, I am convinced if one makes a follow-up for that, the 12 sessions, everybody will see it is a treatment. I also had a friend in America. I told him I have got a chiropractor in Nakuru, and because I don't want to operate my second leg, that's why I'm going. I told him, do you know, when I came to America, I was bedding like this, and I went to them. Walinifanyia kazi mpaka now I can study straight, and I don't have any pain from my back. And that was very encouraging to me. So I am taking the right path. So the treatment, I call it good. You feel a lot of pain, especially when he does it with this, like this. But within seconds, the pain is gone. Like now, I'm not feeling pain, but I am telling you, I have sent tears here today. I'm the doctor. Hey, what are you? What are you doing? I'm going to die of pain. There is no. Now it is okay.
Yes.
And it is okay. So the treatment is good, but it is unique for somebody who does not understand. Me, I have told you I have tried others. There was a man who had been, or he was brought to Nakuru by the Anglican Church. That man, when he went, I went to his treatment. I was given a seat like this, and he took oil and up to there.
Yes.
He applied oil, and then he started. 7 minutes work, but it was like 2 days. It was so painful. Did you hear me?
Yes.
So painful. Unfortunately, the COVID came. And he went back. He had come all the way from Taita. And he never came back to Nakuru. So I was left asking myself, now, I started this one. The doctor has gone. I don't know where to find another one. So, but he was dealing with a very small session. And we were paying 2,500. 7 minutes, 7 minutes. And so when I compare that one and this one is better because it is taking care of the whole body, not just the leg that is suffering, but the whole body. So yeah, I would ask people to come and try and put God first, because you need God when you are going through the treatment, so that you don't give up. But as long as you are feeling the change, you can't give up. You will say, Hiya, hey, it has gone. And you do it another time, Hiya. So it can it can go.
Yes.
So I am going to follow up.
Thanks a lot, Lilian. What a story.
Yes.
Yeah, we thank you a lot for sharing your testimony with us.
Yes.
And we hope you'll receive healing and you'll also tell other people about us.
Yes.
And continue with the session.
Yeah.
Thanks a lot.
Also, I have been taught so many exercises.
Yes.
I cannot put them all in my head without the trainer.
Yes.
But at least I have something I can do on my own. I can sleep on the roller. I can move it now. Today I went down to the floor. Something I have not done for many years. Reaching here.
Yes.
I go down up there. No.
But
And
today you never.
today he never assisted me. He never gave me this. So I went slowly on my own, and I was able to wake up from the floor. So now I'm asking myself, I wish I had gone for the 6 sessions. Probably I would go dancing and walking.
True.
Yeah, so I'm encouraging those who would like to come here not to fear and to know it works. And everything we do, we say God first and God be with me, or God be with us. Yes.
Thanks a lot.
Yeah.
So there you have it, guys. What a story, what a testimony. Remember, guys, to reach us, you can call 0713030397, and we are located along Garden Estate Road, off exit 7 Thika Road, beside Faith Ventures Christian Academy.